This patient came in pain on the upper left side. Tooth number 13 had a previous crown on it, and tooth number 14 had a pretty deep restoration. We decided to do a limited field of view 3D CBCT on this case, and this is the 3D bone rendering. So from the 3D bone rendering, you can see tooth number 13 has periapical pathology that has broken through the buccal plate here, and you can see that it's actually penetrating up through the sinus here. This is the palatal root, and that's the buccal root there. And there's not a whole lot you can really see on a 3D bone rendering on tooth number 14. However, once we decided to do a sagittal slice here, we can see from the sagittal slice, we can see a large area here, and we also can see a area on that distal buccal root of tooth number 14. So this pulp actually was a partial necrotic pulp. It pulp tested cold, but it was kind of mild to cold sensitivity. Tooth number 13 did not pulp test at all to cold. That's because it had necrotic pulp with chronic apical periodontitis on both teeth. So both of these teeth required endodontic treatment. So once we got the patient anesthetized, we were able to do treatment on both teeth, and you can see here the lesions that I pointed out to you earlier, and we completed the treatment. You can see tooth number 13, it had 2 canals, some pretty tortuous anatomy here, and we use Avalon Biomed BC Seal and gutta percha, and we also use EdgeEndo X7 04 heat treated files. And we also did the same thing for tooth number 14, and you can check out, there's really a barren anatomy. The mesiobuccal, the MB2, they all had separate portals of exit. And look at this distal buccal root, really nice kick out, and we're able to negotiate around that curve. So we're able to take care of this gentleman, and he was very happy. So he's going to go back to see his dentist and get these teeth restored.